News 4 is once again teaming up with Roswell Park to remind women to schedule their yearly mammograms. Allie joins us at Roswell Park for this year's Mammothon. Hello there.
Good morning to you, Scott. Yeah, we are kicking off Breast Cancer Awareness Month with a call to action to encourage women over 40 to schedule their yearly mammogram. You know, technology has come a long way, even in recent years. And there are a team of experts here sorting all of that out. Joining us this morning is Dr. Ermalinda Bonaccio to talk about just how far technology has come. Doctor, thank you for joining us
Thank you for having me.
Even over the course of your career, you know, talk to us about how it has changed and evolved.
Yeah, it's been amazing to watch. I mean, we started out when I first was training with film, and then we moved to digital, and now we have something called 3D imaging or tomosynthesis, which is essentially a better mammogram. It just does still require compression, which is often disappointing, but it's a better mammogram because it finds more cancers. It also lowers the risk of having to come back for additional imaging, especially additional imaging where it turns out there was actually nothing there. So it is a much better mammogram.
So when you talk about compression, what do you mean for our viewers at home? What does that mean?
So it means that in order to get an image, in order for us to find cancer, that's the most important part, we do have to compress the breast, even with the newest technology.
I know that there is an emphasis on women over 40. First of all, this is a conversation you should start having with your doctor at age 25. Yeah. Why?
Yeah. Why? Because when we talk about age 40, we're talking about women at average risk for breast cancer. And women who have an increased risk of breast cancer, they often will start having their mammograms and maybe an MRI in addition at a younger age. So we need to identify those women at a younger age. So the recommendation is that women by the age of 25 have a risk assessment by their physician to know if they're at increased risk of breast cancer.
We have a lot of questions for you, Dr. Bonaccio. We know you're not going anywhere. We're going to answer some of the frequently asked questions about mammograms coming up at 7:45. I think it's something you definitely don't want to miss. Now we're going to send it over to Mike for a check of your forecast.